Hello, everyone, and welcome back to Mic Check
2.
Oh, we're missing Aja for her too.
It feels funny just doing it by myself.
I know. But my name is Rachel, and we have...
I'm Sean.
Yay. And today we are joined by a very, very special guest so we can talk about mental health awareness. So I'm going to allow you to introduce yourself.
Hello, everyone. My name is Victor Bonoan. I'm a psychiatric mental health nurse practitioner here at St. Hope, and I'm really happy to be here, really excited to be here.
Yes, we are welcome. Happy to have you here. I feel like mental health, you can never talk about it enough.
Yes.
Right.
So how long have you been with St. Hope, and what brought you to St. Hope?
Yes, I've been with St. Hope since November of 2022. I was searching for a different type of practice setting, more non-commercial. It's a lot different out there, and I wanted to try and work with people that usually need mental health services the most. People that are uninsured, people that come from different socioeconomic backgrounds that may not have access to care. So I heard a lot about St. Hope. I actually used to work at the health department, the City of Houston Health Department, before I was a nurse, before I was a nurse practitioner. I just worked in the office. I did outreach. We did like HIV testing, STD testing, all that stuff. We did the hip hop for HIV concert with 97.9 The Box. Like we did that, and I always wanted to do more. So I trained on phlebotomy, and I was always into medical. And then mental health just was always such an underserved part of that. And people would just always like shy away from it or ignore it or act like it doesn't matter. So that's kind of where I started to keep it in the back of my mind that that's what I wanted to do as a nurse. Also, you have to get a good medical background on top of that. So that's why I went to the ER. And there's a lot of mental health in the ER. That's where it kind of all starts. People in crisis, people that, unfortunately... overdoses and people in psychiatric, psychotic emergencies go to the ER. That's usually the first line. So yeah, that's kind of how I got into mental health. And St. Hope, they were hiring, and there's recruiters out there. They're always reaching out to people, and it connected, and it was great. And I met with the whole team, and yeah, I'm glad to be here.
We are so happy to have you. I just love that you want to help the community. So I really resonate with that.
Good. And then also, May is Mental Health Awareness Month.
Correct.
So we just wanted to go over a couple of things with you, see what your thoughts and processes may be. One of which I know people have a tough time trying to find a therapist or psychiatrist. Can you speak on finding the right psychiatrist for you, since every psychiatrist doesn't really mesh well or they vibe with the person? How would a person go about researching, or do they just have to go and make multiple appointments with different people, see who meshes well, and then go from there?
Yeah, that is extremely important. I would say give it the same respect and research and time that you would, everyone's really big on, physical appearance. Like when people want to go get Botox, people want to go get their hair done. They want to find the perfect person. Do that same research and respect for mental health. Even, going to find a good doctor, do that same research. There are websites out there where you can see pictures of them. You can see their bio. There's a website called Psychology Today. You literally go on there, you type in your zip code, you click on your insurance, and it'll give you a list of people in your area. You can see their picture. It's called psychologytoday.com. You can go on there and it'll give you a list. Sometimes they post videos, and it'll be the actual therapist that you're going to make an appointment with, and they will kind of give you their energy and their vibe. Exactly.
A little bio.
And, like a dating app.
Tinder for psychiatrists.
Yeah. So that's really important. You can't just call your insurance and say, hey, give me a psychiatrist. You want to do your research, and I think that will help you. And it does matter. You may want a man, you may want a woman, you may want an Asian, you may want a black person, you may want a white person, a Hispanic, someone that's bilingual, someone that's into like GLBTQIA causes, and they're sensitive to that and trained with that. Or you need someone that's specifically trained in like specific modalities like trauma or depression or whatever it is. So it's like a little interview process, and that's very important, because you're not going to go to that appointment feeling confident that it's going to be a good connection if you don't kind of have a heads up of who the person is.
You're working with. I totally
I like
agree.
that.
So, can you kind of tell us a little bit, like, what's the difference between a therapist and psychiatrist for those who don't know? Because I know my understanding, I guess, is like therapist is like my feelings, and psychiatrist is like more medication management. Would that be correct?
So yes, but psychiatrists tend to not do actual psychotherapy, but they can do it. Just like
Okay.
a psychiatric nurse practitioner or a psychiatric PA, which is a physician assistant, they can do therapy. They tend to focus more on the medication management because that's what they're trained in. But the difference between a therapist and a psychiatrist would be, yes, their training is different. The psychiatrist and psych nurse practitioners, psych PAs, they have more of a medical training, medical model, medication management. They look at the, cardiovascular organ systems, anatomy, physiology, all that stuff. Therapists look more at the behaviors, thoughts, history, and they are very well trained. They are very highly educated, and they have a lot of hours of experience dealing with people that may already be on medication for mental health problems, have vast backgrounds from different mental health, diagnosis, and they help them to better manage those things, typically without medication.
Right.
And therapy can be as effective as a pill. Like, I would rather someone try therapy first if things aren't that serious or dangerous. And if that doesn't help, then discuss medication options.
So sometimes you can even like refer someone to a therapist before you be like, I know you're seeing me and I appreciate it, but I think this would be the better route for you.
Correct.
Okay.
That would be on the initial assessment when I first meet the person. It's like, you've never been on medication, you've never seen a therapist. How serious are things? How bad are things? To where I think we can let's try therapy first and try and manage the situations in your life, manage your emotions better. What can we do to help you be more of a change agent in your own life? And we're going to motivate you and give you the tools and education to do that. And that's what therapists are very well trained in doing. I mean, they have a master's level or higher. There's another one, you have a PhD, that's a psychologist. In some states, they can prescribe medication, not in Texas, and they have a PhD. Not to say that therapists don't have PhDs, they can have those too, but there's actual psychologists where they diagnose like autism, ADHD. They also manage severe mental illness, and it's just another specialty that you can go into. But therapists are a huge part of what any good psychiatrist or any good psychiatric nurse practitioner would not be able to do their job without a good therapist.
Right.
Because medication alone is not
The answer.
enough. Yeah.
So I was going to say, I'm sorry to cut you off, Sean. But so I guess it would work both ways. Like if a therapist has a patient and they're just kind of like, okay, we utilize all of our tools, but I think medication would be a better option. So what are like some things that you would look for to know, like maybe medication is needed in assistance to your therapy?
So yeah, that happens a lot. We're lucky here at St. Hope. We have a lot of really good therapists that have a lot of experience. Mallory, Josephine, Charletta, they are great at what they do. I trust them. They talk to me all the time. We talk to each other, and they'll literally say, hey, this guy, we've been working together for X amount of time. I really think he needs to maybe talk about some options on medication. And then they'll just refer him to me. They'll get onto my schedule, and then we'll talk. That happened yesterday. I had a patient in Conroe. Shout out to Conroe, everybody over there, and Greenspoint. And so as far as what that decision would be made, let's say they are not going to work. I look at level of functioning in their life. They're missing work. They're not getting up and taking a shower. They're not spending time with their family. They're not taking their kids to school. They're not maybe eating healthy. They're just not functioning in life to what they used to. For some people, it takes someone else telling them like, hey, you need help. You need to go see somebody. Is that a family member? Is that a friend? Is that a neighbor? What have you. So that's where I would say where medication would start to come into play is whenever their life functioning is being inhibited. And that's sad because, they're alive, but they're not living.
Right.
So.
Okay. So
Good.
I was going to ask, I'm sorry.
You're on it today. Go ahead.
I do love mental health, the topic. And like I said earlier, like you just can't talk about it enough. But it's nice to kind of see like the difference. Because sometimes people think like, therapy didn't work and they just kind of give up.
Yeah.
And
they go to 1 or 2 sessions and that's it.
Yeah. And sometimes it does take a little bit more to kind of overcome certain things in your life. And I think that that's typically normal. But I know a big fear for a lot of people, especially like in the Black and brown community, is like the stereotypical, like, you're going to get addicted to this medication or dependent. Yes. So like, is it something that you're supposed to be on for like the rest of your life? Or like, how do you typically assess that?
Yes. So that is a big deal. People are like, the problem is, and that's part of stigma because of what we've seen in Hollywood and, people getting thrown away in asylums. And I know we're going to talk about stigma later, but that's a big deal. Is there's a stigma within our own communities, within our own families, within our own cultures. All different cultures handle it very similarly. They look at it as something that's a private, secret, embarrassing. They just need to pray. They need to get spanked,
Type thing.
Yeah. Or they're making it up or they're trying to get attention. And I hate that because it's a real thing. Right. I've seen it my whole career. It's not going away. It's only getting worse. Anyway, back to what you were saying with the access and people of color not feeling that it's
safe, I guess.
Yeah, that's a stigma. People think they're going to get addicted to pills, that they're going to be a zombie, that they're not going to be able to like talk or laugh or do it. That's going to come down to having a prescriber that explains to you all the side effects, that explains to you what they typically see for that medication, for your situation, and what to expect, so that you're not surprised or you don't ask questions that, hey, I've been taking this medication for 3 months. This is happening. Like, it has to be an ongoing reassessment. I'm not just going to give you a pill and say, okay, I'll see you in 6 months. That's not the way it works.
Right.
If someone's doing that, then you need to find somebody else.
Typically, it's like maybe 2 weeks to a month, give or take, depending on the person.
Yeah. So as far as feeling the effects of the positive effects of the medication. So when I worked inside a psychiatric hospital. Psychiatrists will start people on medication. They're a little more aggressive in the hospital. And aggressive, I mean higher dosing. In the outpatient setting, we're not as aggressive, I would say. Unless it's a really serious situation and you're trying to decide, hey, I might tell this person to go to the ER and go get checked into a psych hospital, then you can maybe be more aggressive to prevent them from having to do that. But that's a case-by-case basis. But as far as you can start feeling the effects of the medication within a week.
Okay. And then maybe it's something as mild as like, I just feel calm. Like I don't necessarily feel like a zombie. I'm just chill.
Yeah, I feel calmer. I don't get worked up as easy. I can feel like I can manage my stress a little bit better. And then that should get better with time over the course of usually 4 to 6 weeks. That's what we typically say. It takes about a month minimum to get the full idea, like, hey, is this going to work or not? But you can, as early as 7 days, start feeling the effects. Good effect.
So typically, does it mean like a lifetime, or do y'all like try to do like wean off kind of methods?
Yes. So and that goes back to that initial assessment. Like, what have you tried to get this under control? And you may be one of those people that you just deal with anxiety. You just deal with depression. And there's a whole lot of we could do a whole podcast on reasons why, and we may talk about that in a minute.
Right.
But you've tried all these things. You've tried on medication. You were doing okay. You got back off medication. You started doing bad again. So maybe you just need to be on something, and that's okay. It would be like if I had migraine headaches. I had diabetes. I had high blood pressure.
Yeah.
I would be on medication as long if I exercised, lost weight, ate a perfect diet, and my blood sugar was still high, and I was still having migraines, or my A1C was still crazy, then I would get on medication, right?
Right.
That's what I want mental health to be treated like. The same respect that we give medical help, medical care.
Yeah, because it is very shunned, especially in different communities of like mental health. Like, you're not allowed to talk about it. Like you were saying, like you were saying, the pray, the spankings, and all of those things. So Do you think we can prevent mental health problems like with just the therapy? And because a lot of people think like you said, oh, he's faking it for attention, or she's just acting out because she wants attention. But it should be treated more like a diabetes thing. Like it's not really something you can control. So do you think it's preventable?
I would say so. Preventable as in my mom or my dad has depression. Will I get depression? Or my mom or my dad has cancer. Will I get cancer? If you look at it that way, maybe not as preventable, but that doesn't mean you have to start to express depression or anxiety symptoms because there's other factors that are involved in that. Your environment, how you were raised, socioeconomic background. Are you living in a healthy environment? Do you go to the doctor regularly? Are you in a school where you feel safe? Are you in a home where you feel safe? Do you have parents that love and support you and take care of you and, treat you with respect and check in with you and show you love? All of that can help prevent someone that may have been predisposed to depression or anxiety or what have you from even ever having to experience that. So I hope that those protective barriers and support systems, whether it's a good grandma or a good aunt or a godfather or a godmother or whoever, can prevent that kid who may have had parents that struggled not ever have to struggle. So I like to believe that yes, you can prevent it, but it's not a black and white thing.
Right. Just because you had a good support system doesn't make you not at risk, technically.
Yeah, you're not immune from it or protect. Even if your parents have all the money in the world, you go to the fanciest schools, you live in the fanciest neighborhoods, sometimes those kids have a lot more issues than people that live in not so fancy areas and not so fancy schools. And that comes down to your support system around you. You don't have to have money to be a good person. You don't have to have all these resources to be a good grandma or a good parent. It helps, but
right.
you know right from wrong, and you know how to teach your kids how to. I look at myself when I'm in traffic and I'm driving with my son. There's my ideal self, and then there's the self that I want to honk the horn and
cut the person off.
Y'all know Houston.
Right.
So looking at those little things matter because he's looking at me as a model of how I'm supposed to act. And I may not always be perfect, but I'm working towards it.
I always say the trauma I've given my child, she's going to need a year supply of free therapy for me after this because it's hard. It's hard to be mindful sometimes when your ideal self versus like reality. You're just like beep sometimes in your traffic, and you're just like, oh, I'm sorry, mommy hit the horn.
Or not just at traffic. When you're at the store, you're at HEB, you're at Target, you're at Walmart, wherever. You have people that are, we're in Houston.
Yeah.
You don't know what's going to happen. So how you handle those situations, how you carry yourself, how I think managing your emotions is a huge tool. Managing your own internal emotions.
That's hard for people to do.
Oh, yeah.
It really is.
Airport, traffic,
work.
We don't have those problems at St. Hope. We don't know.
No. We love St. Hope.
No, any successful job is going to have ups and downs, and that's okay because we're all human. And part of being human is being able to know, like, hey, I was wrong in this situation, or I wasn't, or how can we make this better?
I'm gonna do my little Aja moment. She would say, "You have to give yourself grace." That's Aja.
Oh my God.
That's Aja. Right?
You know what? I actually say that sometimes to patients. Give yourself some grace. Don't be so hard on yourself. I think everyone's redeemable. I think everyone can be saved if they're willing to do the work.
Right. But it definitely takes work. Like you can't just, like you said, go to the initial appointment.
You have to be consistent. Consistency is the word.
Yeah.
Consistent.
Correct. And as far as taking a pill, you just take a pill and you expect everything to fix itself. That's not the way it works. Unfortunately, that would be awesome. We would be all good, right? So you have to understand that it's a part of the treatment. It's a holistic approach, part of the puzzle. Doing what you can, eating healthy, sleeping, drinking water, getting enough physical activity. Sunlight is a big deal. Getting enough rest, limiting, substances, limiting like cigarettes, alcohol, marijuana, limiting or eliminating that, especially if you're trying to get on track. I wouldn't suggest doing any of that. If you're really struggling, you're starting on medication, you're in therapy, I would get rid of all the substances if you can. I mean, coffee's fine in moderation. And then if you're doing all of that, you're in therapy and that's not helping, that's where I would say, all right, let's do some medication, like a low dose of something to try and help you get you out of this funk that you are in and motivate you to start breaking out of that. And you may do that for 3 to 6 months, a year. You know, maybe you had a death, maybe you have a divorce, maybe you lost a job, maybe, you know, whatever situation you're going through, that situation is going to change. And then we can start tapering you off the medication. And then hopefully you're in a space with all those other things that I talked about to keep supporting that progress that you made. Right. And that's the goal.
Right. So I have a question. I want it today, Sean.
You really are. You had some coffee today.
I did not. Okay, so if you could change a couple things in the way that mental health is done in our current healthcare system, what would you do differently?
Yes, there is. I just saw an article. I'm subscribed to a lot of like NAMI and Nurse Practitioner and Psychiatric news information, but it's like good stuff. It's not like fake news. It's real like scientific stuff from like World Health Organization, CDC, FTC, NAMI. I want to say Texas was ranked like 49 or 50 in access to mental health treatment. Texas, the whole state, not just Houston, not just Dallas, the whole state. So all those little border towns, all the towns, everywhere. I think that we are like 20 years to 25 years behind medical care with mental health. And it's sad because there's huge increase in suicide rates. There's huge increase in people abusing drugs. Young people are using more drugs. They're committing suicide more often, not just typically Caucasian or white. It's now Black, Hispanic. Suicide is becoming more of a problem. Yeah. And that's just to say, you know, the population is bigger. So the numbers are skewed, but still the percentage is going up. So I think and, you know, gun violence is a big deal too. And a lot of people are saying, oh, it's because of mental health, it's because of mental health, which that's fine to say that. But I think that just may help in the long run with just funding to grow. If they're going to use it as their political reason to do it, then all right, great. But they're trying to build more hospitals. I think we need to build more facilities that don't have a model of a jail because that's not therapeutic. Any psych hospital I've ever worked in, it doesn't look as nice and pretty as like a dentist's office or a medical office. It looks very cold and dark and you know what you think of in the movies, but we don't treat the people that way, but that's the environment that it looks like. And it's sad. Like we need to step it up as far as giving it the respect and the money that other medical issues get. And it is a medical issue because it's your brain.
And a lot of people don't see it that way. Like you said, oh, he's faking it.
I mean, look, breast cancer awareness. The whole city, everybody wears pink ribbons. What is the other one? Hypertension, blood pressure, the red dress for women. Even, you know,
lupus,
autism.
Purple.
Lupus, yeah. But where's the mental health? It's always like
nobody wants to talk about it or just the elephant in the room.
Or, hey, I have a friend. She just got in a car accident. You know, let's start a GoFundMe. Or, let's start a Facebook page because for this lady, her kid is sick or whatever. And that's great. But if someone has a nervous breakdown or someone tries to commit suicide, where's the
support for that?
People do have a stigma against mental health. They're going to be like, is this person violent? This is what the stigma is. People think you're violent, you can't be trusted,
unstable,
you're dangerous.
Yeah.
I can't have you around my children. I can't have you, or you're on drugs. Even though your drug screen was negative, you're on drugs. I can't trust you. And that's biased and that's discrimination. It is, because if someone had back pain or they had seizures or whatever, they wouldn't be speaking to them or treating them that way.
Right.
Yeah.
It's definitely you're gonna get talked about more. If anything, I feel like it's like if you were to break down right now, like it's gonna.
Like, oh, did you see Sean have that whole breakdown? He was crying and rolling in a circle in the bathroom.
I don't know. Yeah, I'm gonna stay away from him instead of like really just like, hey, Sean, is everything like really checking in with people? I don't think that we do that enough, and just being like, hey, I remember you mentioned this in passing that you were feeling this type of way. Like,
and we brought that up in the past too in our
Yeah.
previous podcast about making sure you check up on your friends and family, even like
the strong friend.
the strong friends, because you never know how somebody may be internally feeling on the inside. So it's always important just to give that phone call once a week, even like your parents,
text, even a text. Yeah.
even your parent. Like my mom, I call her, try to call. Maybe call. No, I'm just kidding.
Yeah.
I'll do a call like once a week and like, hey, just making sure you're good. What's going on? Oh, I'm fine, thanks. Go back to your life.
That's good.
Okay.
It can be as simple as that. And that may be what she needed that day. And you didn't know that, but it was on your heart to do that. So that's awesome. Yeah, little stuff like that.
I have one friend. We just sit on the phone in silence. We're just like, yeah, today was today, and then we just sit.
I do that a lot.
And then it's just like, all right, well, we just realized we're like, oh, 45 minutes, our little timer's up. Have a good night. You know, like I think it is important because even though like you're quote unquote successful and things like this, like you do go through things, and people. I think with social media, like kind of like idolize and like, oh, I want to be like this. We talked about it last time.
Or they put the prettiest parts of their life on Instagram and Facebook and Snapchat and all that. They put on what they want everyone to see.
Right.
And everyone looks at them like, oh, everything's great, everything's perfect. But maybe that might not be the case.
Yeah. And then also, you know, there are some people who like, you know, they do show like the bad, but I think like it's not really like shown. Does that make sense? Like they may talk about it, but like,
we're not going to dive deep. We're not going to unpack.
Right. Like they'll just be like, oh, I had to take 3 months off because of depression, but I'm back. Like, you know, but like,
but what did that look like for you?
What does depression really look like? Because it's different for everybody. Like, you know, I think it's different stages.
Yeah. And let's talk about that because what I've seen ever since COVID, a lot of celebrities are coming out and actually being more open about it than in the past. It was always the secret. Oh, exhaustion, emotional exhaustion. That was code word for, you know, drug addiction, depression, anxiety, psychosis. Britney Spears, when she shaved her head. Kanye West.
When he was Kanye West.
Lady Gaga, she just came out. She takes an antipsychotic medication because she deals with severe PTSD symptoms, which is like nightmares, flashbacks, panic attacks. She was a victim of sexual assaults going up through the industry.
One of my favorite people is Jason David Frank. Otherwise,
the Green Ranger, the White Ranger.
The Green and White Ranger from Power Rangers.
Yeah,
it was devastating to me because that was one of my childhood idols. So when they found out he had severe depression after he got a divorce from his wife, and nobody ever knew. And
his daughter, I think they were having a custody issue as well. He lived in like North Houston. Yeah, like North Houston area.
And
he
it
owns
just
a
shows
restaurant.
You never know what people are going through. Don't get choked up, Sean.
You
love the Green.
No, my favorite singer, one of my favorite singers, the lead singer of Linkin Park, is a rock band. They also they also did an album with Jay-Z, so they're not, you know, they're cool.
They're cool.
Yeah,
certified.
They're cool. Yeah. And then Chris Cornell, DJ AM, who I talked to you about earlier. Those were some of my favorite. Also, Anthony Bourdain, the guy on CNN, super cool guy. He did those where he would go eat and go to all the countries. They all suffered from depression, and a lot of them abused alcohol and drugs, and then they ended up committing suicide, unfortunately. And these are the people that have all the money in the world, all the resources in the world, and all the, you know, the reasons and the help to get better, and it still wasn't enough. And that's disheartening, but at the same time, a lot of times because of the celebrity and wanting to put on a good image, even the people close to them didn't know what was really going on.
So that could really be a huge misconception when dealing with mental health, is just because, like we talked about earlier, just because everything may look okay, it's not okay. Always check on your people. Make sure everyone, just even a brief, hey, how are you?
Correct.
And I know we always say you're going to be your best advocate for yourself. So like sometimes if you're just not feeling like the daily functions of life are just becoming a little bit more difficult, like that's a great time to like actually seek it. and not be ashamed of it, because like you said, somebody's dealing with something always, but you have to be an advocate for yourself and be like, okay, this is probably just a little not normal. But I guess with it being mental, it's kind of hard to decipher, like, is this just a bad day, or is this like, so what would you look for, like if it lasts longer than like a week or two, or?
Yes, I would say typically it's 2 to 3 weeks. If you're having depressive symptoms, all of our nurses and medical assistants, they do a PHQ-9 when a patient comes into one of our stay-at-home clinics. It's part of every single visit, every single time. If it's a certain number, if it's above a certain number, then they refer them to us. And if they're in crisis, I see them right away. Or we get on the Zoom and we see them right away, whatever we need to do. We always will make time. And it asks questions. Are you feeling hopeless? Do you feel down about yourself? Do you have any thoughts of not wanting to be alive? All those detailed questions. And there's a lot of different actual forms in there that we use, and we'll assess them and talk to the patient about every single question, like what did you mean, how, etc. So those type of questions help you to kind of get a feel of how they're feeling. And then I would ask, time frame matters. So if you've been feeling like this for a week because you just lost your job, that's different than you've been feeling like this for 3 months. Then it's probably more severe. But I would say typically 2 to 3 weeks, every day for the last 2 weeks, if you've just been feeling down, unmotivated, or you're worrying out of control. You can't drive because your nerves are so bad. You can't go to school. You're not getting up and taking a shower. You're missing work. You're on FMLA. You're on leave, not for a physical problem, which sometimes mental health can present as physical problems like chronic pain, chronic headaches, stomach problems, appetite issues. All of it's connected. 90% of our serotonin, which is a neurotransmitter in your brain, is produced in your gut. So all of it's connected.
I thought I just had gut issues because I'm a Virgo.
There is a gut connection.
Oh no, that's definitely a Virgo thing.
Yeah.
There's a connection. Serotonin stabilizes your mood, stabilizes your anxiety. It's the target for medications in most depression and anxiety treatments. It helps regulate your sleep and your wakefulness. So it's very important. There's other neurotransmitters. Neurotransmitters are basically the way your brain cells communicate with one another. And there's a misconception that you don't have enough serotonin, or you don't have enough dopamine, or you don't have enough norepinephrine. Norepinephrine is another one that has to do with energy, your body processes, and things like that. The medication helps you to use that amount that you have naturally more efficiently by reducing and limiting its reabsorption, meaning it doesn't get used up as much. So it can sit there in the neurotransmitter, between the neurotransmitters and the synaptic clefts, so it can do what it needs to do to help you run more smoothly, your brain. Right. And that's what the medication does. So let's say you were taking the medication for a year, that seems to be working good. You take the medication away, it could go back to the way it was. And that's when you know, like, hey, maybe I do need to be on medication. If you're good and things seem to have balanced itself out, your body is producing everything at its top, then you're good. So it's all going to depend on the long-term reassessment. You just need to keep reassessing.
So what would you say to the folks that, we do the questions, the depression screening all the time, that just kind of already know to circle no, or like if they accidentally circle yes, or they circle yes intentionally, like asking for help, and then now they have a team coming in there like, what did you mean by sad for longer than 2 weeks? Like they're like, oh no, I didn't mean to do that. Like, or did I actually put yes? I meant no. Because I do feel like that does happen. People, once the help actually arrives, they're kind of just like,
what did I do?
Probably not ready.
What did I do?
Yeah.
What did I do? Like, why did I tell the truth?
Yeah.
But I try to tell them that I say it all the time. Like, I'm not the police. I'm not an investigator. I really want you to be safe. And if that means that at the end of this conversation, I say, hey, I don't feel safe with you going home by yourself. And I need to call the non-emergency for them to come take you, or the emergency to take you to the ER, the nearest ER, where you can sit and get a psych assessment and get transferred to a psych hospital. Then that's what we're going to do. Right. But kind of give them that, caveat that you're there to help them. It's not, they didn't do anything wrong. Right. I'm not here to get you in trouble. I'm not here to embarrass you. I'm not here to make you lose your job. But Is your job going to matter if you go kill yourself?
Right.
No.
Right.
Is your job going to matter if you're
You're not
okay?
functioning at your full potential yet.
Exactly. So and then that may be in the beginning. I may need to push really hard to be the advocate for them until they're motivated to be their own advocate. I feel like we can heal ourselves, but you have to get the tools and the motivation and the support to do that.
Right.
If, it's like teaching your kid. You teach them how to take care of themselves, right? That's what we do as good parents. But it takes time. Right. It takes effort. It takes patience, a lot of patience. So you got to be patient with your patients, and you got to meet them where they are. For them, the success may be, hey, I got up and took a shower and I went to the grocery store this weekend.
Right.
When before, they were just Instacart or DoorDash and they weren't even taking a shower. So that's a win. And I would give them credit for that.
Yeah, we celebrate wins over here.
Exactly. I mean, that's what it is. And it's as simple as those things sometimes. Hey, I went to my daughter's little soccer game on Saturday, which before I would have just let her grandma take her. And I'm feeling better. Great. That's amazing. And that's going to be different for everybody, depending on where they are. And you just got to meet people where they are and just be honest and don't make it too complicated.
So I want to switch it up just a little bit, and not talk about the patient. I want to actually ask you something.
Okay.
So
He's like, uh-oh.
right, he got ready for it.
Yeah, he's sitting up. If y'all watching on YouTube, he's sitting up now.
So what do you do, being a mental health specialist? What do you do for yourself to just uplift yourself on a day-to-day basis? Like, what do you do to maintain your mental health?
So I thought about that question because that's a very good question. A lot of times in the mental health profession, it can, even in any type of helping profession, nursing, doctors, surgeons, therapists major, because they spend a very long time in intense therapy, hour-long sessions. A lot of times our sessions might be 20, 30, 40 minutes at the most, but it's different. But anyway, I think a lot of people, what I always say is you can't give from an empty cup. So if I'm not okay and I'm not rested and I'm not going to give my best clinical judgment, I'm not going to I don't want to not ask the right questions or make the right recommendations for medication or treatment for the patients, because that's what my job is. I'm privileged enough to be able to help them do that. Like, I went through all the schooling and learned everything and got all the experience with all the psychiatrists that I've ever worked with as a nurse and as a nurse practitioner. I've learned from their wealth of knowledge, and they deserve to get that from me in that session that they have with me. So if I'm not on top of my game, my own mental, then that's not going to happen. So I prioritize sleep, big time.
How many hours of sleep are you getting?
At least 7.
Okay.
At least 7. Even if I go to sleep late, or I'll take a nap to catch up during the day, or if I have something going on with my son, I'll put a nap in. There's a psychiatrist. He would take a nap in his office during his lunch break. That's just what he would do.
Right.
That's what I do on my lunch break.
Yeah.
Naps are key.
It's good. We're always so concerned about charging our laptops and our iPhones and our iPads. We got to charge our brain too. It's very important. So I also, I don't exercise as much as I used to, but I do exercise. I prioritize at least once a week getting cardio and lifting weights, because that helps release tension and anxiety and all that, bad energy. It just gets it out. And you never feel bad after you complete it. You may feel sore or tired, but you never feel bad that you got your workout in. And then I try and keep my life simple. Like, I don't try to pull myself in 20 different directions if I can avoid it. Like, my son, he's really big in sports, but I mean, he's not like the next LeBron or the next.
Yes, he is. If he's
Jeremy Pena, but maybe we can aspire. We can aspire. So he's in soccer and baseball. So he has tournaments and practice and stuff. But that's the simple. I think those are the good, simple things in life that we all enjoy. And then even just like going to eat lunch with my mom, going to my family's house for whatever gathering, little stuff, simple. Keep it simple. I like to say keep it simple. Like, we don't have to have a big elaborate whatever.
Like, you don't have to always be doing something.
Yeah, and that's okay. Sometimes we get uncomfortable with being quote unquote bored, but that's your mind and your body's time to just like chill. And then when it's time to have fun and get out there and be social and do what you want, do what you enjoy doing, that's fine too. But it's all about balance. And I think Me, I prioritize sleep, water. I drink a lot of water. I try and stay hydrated as much as I can. Sometimes I catch up at the end of the night, I'll be honest. I don't drink it during the day.
No, we love the water comment because like everybody that comes on, like from the nutritionist and they're always like water.
Because your cells need water to process all this stuff that's going on in our body and every organ in our body, in our eyes, in our heart, in our brain. Like it needs water to kind of do all of the stuff it needs to do. You can take vitamins all day, but if you don't have water, you're just gonna poop it out.
Right.
You're not, metabolizing it the best that you could be. And then just checking in with my wife, like making sure that me and her are good. Those are some of the most important relationships in your life is your loved ones, your wife, your partner, your husband, whoever, your children, or, close family. Keeping those connections, social connection and social support. We're social creatures. Humans, we're social. A lot of depression comes from loneliness, isolation, and lack of social interaction. Think about, I'm not hating on cat ladies, but look, the cat lady, she's just in her house with 20 cats. She may see the mailman every now and then, and that's it.
Right.
That can cause depression.
Because we need socialization.
We do need socialization, and it doesn't have to be going and turning up and taking shots and bottle service. You can go.
I feel attacked.
Yeah.
All right.
How did he know?
I feel attacked on Sunday.
A good brunch.
Yeah.
No, you can go. You can go. Memorial Park's beautiful. You can go ride a bike. You can have a couple of drinks. That's fine. But everything in moderation.
No, it's just funny that you said that because about every other weekend, I'm kid free, and I always felt like I needed to be socializing and doing something, but now I'm finding more balance. I guess I'm getting older. Just like I like to kind of sit down, and being outside is a little bit expensive, so I'm okay with just sitting in the house and checking it on loved ones and things like that. And I also want to say, you said you only work out a little bit, but we almost won the championship for our softball classic. Victor was our lead man, our pitcher out there. He held us down. So whatever you're doing is working.
Your nephew.
Oh, my nephew,
Caden.
Yeah, he held it down. But I just want to...
Awesome. Thank you, yeah.
Yeah, Victor, he was out there.
I'm looking forward to next year.
Troy is booing because we whooped their butts out there. But it was a good time. So I think even stuff like that, you kind of forget. And it's good to like socialize with your coworkers and things because like sometimes it could just be work. And it's just like all I feel like we do is work because we
just work and type.
Yeah. Yeah. Right. So it is nice to actually have those type of events and
it's good bonding. It's good bonding and it gets you out of the office. I thought it was great. The other event, we went to the Astros game. That was awesome. Like those things. A lot of other organizations don't do that. Either it's not in their culture as far as like what they're trying to build, or they just don't have the resources for it or whatever have you. Right. But it makes a difference. Right. Those simple little things, saying happy birthday to each other on the twist, those little things do make a difference.
Even like our, for Sugarland, I know. For some reason, we're finally starting a little small workout group since we have a Planet Fitness that just got built next to our Atlanta Way. Good. So everybody's planning on signing up. It's like $10 a month. So we're all going to start going and go.
See, and that's something positive. Yeah. Everybody wants to hear some hot tea and some hot gossip. Why don't we do some hot health, self-care, and that can be more positive for everybody. Your patients are going to feel it. They're going to, when you walk in the room, they're going to feel your tension. And that's not fair to them. Right. We have to be respectful of their time, and they're there to get help from us. We're privileged to be in a position to be able to help them. I try and give that respect as if, and I'm not trying to make myself seem like,
you're great
Mother
every
Teresa,
day.
but, I think, and it comes down to it sometimes when patients don't want to go to therapy or they don't want to take medication or they don't want to stop doing drugs. I tell them, hey, if you were my brother, this is the exact advice I would give to you. If you were my sister, you were my dad, you were my cousin, this is what I would be telling you if I wasn't your provider right now.
Right.
And I really feel like that connects with them more times than not. Because they're like, this dude isn't just treating me like I'm just someone to get him out of his office. Like he wants me to feel that connection. Care. Yeah. And I think that had to do with me being a nurse for so long because the doctor goes in there for 10 minutes and that's it. And we're the ones that is with them for 12 hours. Right. So I know their mom. I know their dad. I know where they came from. I know what job they used to have. I know what struggles they've had. I know what has worked, what hasn't worked. And a lot of them have bad experiences with mental health professionals or bad experiences with doctors. And they bring that kind of chip on their shoulder into the room. And it's my job to let them know, like, hey, I don't want to be one of those people.
Right. So we're going to have to bring you back for like a part 2 because
Yeah,
I feel like I have
part
so
2,
many
3, and 4.
questions. Yeah, 2, 3, 4. I think this was really great and informative. So, but we have to unfortunately wrap it up. So is there anything that you want to leave the listeners with that you feel we didn't cover or just something important?
I would say my main thing is stigma. Like, I want us to talk more about mental health. And I think COVID was a big catalyst for that because people had time to sit and be with themselves and be with their family and really take evaluation of their life. So talk more about it the way we talk about, like I said, like breast cancer and lupus and all those things. And I want y'all to know that we're here. It's me, Dr. Williams is a psychiatrist. Legine is one of the part-time psych nurse practitioners. Jane Oliver is one of the nurse practitioners as well. She's full-time. So we are here, and you can refer to us, and we want y'all to refer to us. And then there's also the Charlotta is the head of behavioral health. If you have any questions, you feel free to ask me. You just email me, twist me, Mallory, the whole team. We're here, and we want to know that we're a resource. We are getting busier, which is great.
Right.
But we can always make time to try and fit something in because of technology. Like if I see a patient in Dickinson one day, I'm at Conroe. I'm at Conroe Tuesdays and Thursdays. I'm at Greens Point Monday, Wednesday, Friday.
Right.
And one thing I just want to throw out there, for those that actually go into the locations, a lot of times, even if you may not need a psychiatrist per se, and you just need a therapist, most times they're literally across literally 5 steps away. So if you, let's say, for Sugarland, we have Miss Oliver, and she may say, hey, why don't you talk to this person real quick just to get a brief assessment, see how you feel. She walks you right across, gives you a warm handoff, introduces you to Mallory. Hi, this is Mallory. She's our therapist on hand. Just give her 10, 15 minutes of your time just to see how you feel.
And it's great that they have that relationship. Of course, if they're in session, I would have to wait and just like message them and say, hey, can you see them after, et cetera, just to give, just courtesy. It's just a matter of coordinating it. It's just a matter of logistics and make it work. The HCMs at the clinics, like Tony at Conroe and Q at Greens Point, they're always a resource as well. Like, hey, I have this patient. I'm with the patient. They'll go in and sit with them or talk to them, whatever we need to do to keep them safe, and kind of coordinate if we can get the therapist to see them right away, and or me see them right away.
Right.
Because that's what we're here for. I don't ever want to feel like my time is more important than their time, ever. Like, if I forget that, then what am I doing?
Right. I love that.
I love it.
So we are so happy that you were able to join us today on this Friday, and we look forward. We're definitely going to have to bring you back because I'm like, wait, I want to ask this. I need to ask that. And what do you think about this? So we'll definitely have to bring you back for mental health part 2 because I feel like you can never talk about it enough, and that's one way to break the stigma.
And this is Mental Health Awareness Month, so that's great to tie this in. And I think it's growing and it's getting more exposure. More celebrities are coming out. Like Michael Phelps just came out and said he deals with depression, doing commercials. And so I think it's great. So people can understand that it's not this scary, embarrassing, dangerous, violent thing that you have to be ashamed of. It's something that we can all just work better at.
I love that.
And then if by chance you think you may have any kind of issue that you would like to talk about, you are more than welcome to visit our website at offeringhope.org. You can use our chat feature and speak with someone to schedule an appointment, or you can call directly at 713-778-1300. And
there's also a number 988, which is 24/7 mental health support line. It's like 911, but for mental health. They're trained.
Is that? Oh, I was waiting for the whole number. It's
988.
That's it.
988, like 911. It's not 911. It's 988.
Oh, nice.
Or you can always call 211 and they'll connect you. That's in Houston. It's 24/7. They have staff. They have medically trained people. It's not like you're going to call and the police are going to show up and knock your door down.
Right.
We don't want that.
No. So 988. That's a good resource. I love that.
So even if you don't want an appointment, 988, you can also call as well.
I mean, we'd love to have you here for sure.
So, and remember.
And always remember, here at St. Hope, you're more than just a number.
Correct.
And I just want to give a very special shout out to my team at Sugarland, especially Dana and Jessica. And I hope they all have a wonderful day today.